Welcome to Getting Better with Dr. Adam. Dr. Adam Silberstein is a clinical psychologist who has been working in the field since 1993. With a broad range of clinical experience, including state psychiatric hospitals, adolescent residential treatment with a trauma focus, the Department of Corrections, and in the addiction treatment arena. Adam is currently in private practice and serves as a clinical consultant and supervisor for a number of treatment centers. This podcast is for general information and entertainment purposes only. This should not be considered treatment advice, nor is it a substitute for an individual treatment plan. If you have questions or concerns about your individual situation, it is strongly recommended you consult a licensed professional to talk about things that are specific to you. If there is an emergency, it is strongly recommended you seek treatment at your nearest emergency room.
What a conversation I just had. Dr. David Motsumoto. I can't even begin to address his credentials and experience. Suffice it to say, he's a leading expert in the field of nonverbal behavior and communication, amongst other things. He is a professor of psychology at San Francisco State University, the director of HumanTel, which is his company with expertise in the fields of emotion, nonverbal behavior, deception, and culture. He has over 400 publications. This is somebody who's really, really, really dedicated his life to this field of study, in addition to being a U.S. Olympic coach in judo, and I believe a 7th degree black belt. So you can imagine I was a little nervous talking to this guy, and he was so easy to talk to. We actually spoke on. I had him on Zoom, and we recorded it, and he was just so easygoing. And to me, the interesting question is the application of his work is so vast. He studies these micro expressions, these what we call leakage, the expression on a facial level, universal expressions that are so subtle that represent potentially conflicting emotion and various expressions of emotion. He studies gestures, and he studies everything in the realm of nonverbal behavior and he calls it data superiority, just information. And this information is so valuable that many government agencies and different facets of industry use his services to help them understand information. And I was interested in it as a clinician, as someone who works with people, and we use words like vibe and energy, and those are like really popular words. What do we mean by that? What do we pick up on? How do we understand the idea of expression and picking up on that which isn't verbal? So, I'm just recording this introduction right afterwards. I'm still tripping out. So I really enjoyed that, and know that there's so much information that's being conveyed. Both, I'm sure I convey it. I was so nervous. He busted me. He busted me being nervous, or I busted myself, I should say. He didn't bust me. He wasn't like that. But I told on myself for being nervous because he saw me. I was scared he was going to see my microfacial expressions. They probably weren't. They were probably pretty obvious. But he's just a very, very interesting guy to talk to. If you want more information about Dr. David Motsumoto and his work, and access to all his publications, you can access his work at humantel.com. It's HUMINTELL.com. Well, this is exciting for me. I have a distinguished guest, Dr. David Motsumoto, and I'll get into that. And when I say distinguished, I mean distinguished. But this is also my first quarantine recording live episode. I've been releasing ones that were in the bank, and this is our first time taking out live, and I'm really excited about that. So welcome, Dr. David Motsumoto. It's so nice to have you.
Oh, thank you for having me. It's my pleasure indeed.
So I want to just say something funny. There was a little bit of a miscommunication. Here I am. I'm speaking to probably one of the renowned experts in the world on nonverbal communication, gestures, and assessing people's what they call micro expressions, from what I know, these little hints, a fraction of a second, that tell what somebody may be concealing or what may be buried in somebody's unconscious. And when we set this meeting up, which took a while, on one of the last exchanges with your assistant, I believe I was told, "Hey, Dr. Matsumoto wants to see you, and could you do it on video?" And I'm like, my reflex was, "No way." My reflex was, there's no way I want to be my micro expressions revealed. So then that was, I did that for about an hour. I'm like, I got an easy out. I'm technologically challenged. Then I was like, no, I got to honor this. I got to let him see me. So I spent Memorial Day, a portion of Memorial Day, figuring out that you could record, that this equipment I have could record. And lo and behold, you get it on the line with me. And you're like, oh, we can do an audio. So I was all right. So what do I know?
Well, listen, I'm glad we're here finally. And I do prefer to see people when I talk to them. But like many people, I do a lot of interviews by audio only. And if that's what you prefer, you prefer. It's okay.
Well, I like the idea of being open to the spirit, especially the discussion that I hope to have with you, is really about helping. The podcast is called Getting Better with Dr. Adam, and the spirit is I want to get better as a clinician, and I want our patients, our clients, people who work on the ground with people, we want to help them get better. And I've been working in the field for a while, and I think to myself I started in the in working in the prison system, and I just I'm thinking about you and kind of what would have been helpful. And I remember walking in my first day, and I see this huge guy in prison uniform, and my reaction was, I'm dead. Dead man walking here. I am dead. I walk past an inmate for the first time, and how little did I know that was a level 1 inmate. That was the safest of safe. And I worked in a maximum security prison, and over time, right, as I got more comfortable, I developed the skill set of understanding where I am and knowing how to read situations to the tune that it almost became innate that I can feel in the atmosphere without seeing faces how violence would erupt. You can feel it in the air when there's a riot going down. You can just sense it. So all of that by way of saying, sometimes I think I know things and I'm totally off. And then other times as I work in the field of addiction a lot, and there's a lot of, I can walk into a room at this point, not because I'm great, but I've been doing this for a long time. And I know I'm picking up way more than words, right? I know I'm picking up words, and I'm picking up a lot. And when I train people, they're asking me questions about what I'm picking up, and I'm thinking to myself, well, what am I picking up? What am I picking up in these exchanges that allows me to have a sense of deeper meaning beyond just listening to the words? And that's how I thought, what can I do to contribute and help myself and others in terms of understanding what it is you do?
Well, that's a great introduction. I have so many associations to what you're saying about research things and what happens in real life and all that kind of stuff. But I guess the one of the first points I'll make at this point is that you're exactly right. There's so many cues given off by a context or an environment, which includes people, of course, that are available to us, and people receive those cues. And for a large portion of our lives, I think, especially most of us living in this country and many other affluent countries where we don't have, we spend, I think today's societies does a lot to dampen our receptivity for those kinds of things. And we actually have to be in a context in which we allow ourselves to then refresh our senses to get back on board with all of that. And That all being said, there's a lot of cues I think that we take unconsciously, which many of which we don't think about, like pheromones and other kinds of hormones that may be floating in the air, and other kinds of those vibes that one has that you, when you walk into a room or into a context. So there's a lot of things that I think are unconscious, and there's a bunch of things that are just a little under consciousness, where that if we pay attention, we can get more information.
So I want to say,
certainly
I want to say that the word, like I'm in Southern California. It's probably the epicenter of. You can't imagine how many therapists' offices are in West Los Angeles, where I am. It's just unbelievable, and everybody's working. So there's a lot of, it's pro-therapy town, as is Manhattan. Other places are. I'm sure San Francisco, but words like vibe and energy are such popular words in the world I'm in. Vibe, what was picking up on something, and energy, and you're confirming that. You use the word vibe too.
Yeah. Well, I absolutely believe it. You know what? I think actually humans are if one believes in evolutionary theory, and you think about all the other animals that have senses, I think all the other animals actually have those senses a lot better than we do, because they don't have those words. And so they have to rely only on such senses to be out there surviving. And I think, of course, we also have such senses, but we don't have them to the degree to which other animals do. And language compensates a lot for that. But what your point is that there's a lot of cues out there that we are getting, and that we could take advantage of and leverage in our work.
So yes, and some of them you were saying are cues that we can just innately pick up on, and some of them are more achievable in terms of raising our awareness as providers. There's stuff we can do that could help us actually raise our awareness. One of the things I was thinking before we met was, I think about the typical therapist's office and what they want. It's like heavy on crystals, right? I'm tired. A lot of crystals going on in Los Angeles. Beautiful sounds and chimes, and very, very, very calm. And in my experience, the therapist, myself included, I don't want somebody coming at me in anger. I want to keep it calm, and I want to help people. I use this word regulate, stay regulated. But that may not simulate real life experience, right? And I feel like a part of the reason I was so interested in speaking with you is as I train people, there's a lot of, I think, therapist challenges. I want to know the story and help up to a certain point of emotional expression. And at a certain point of emotional expression, I don't like it when a manic person or someone with charge comes at me, right? And my way of dealing with it is mastery over time in the setting. I've seen a lot of pitches, so I know how to handle it. But I guess maybe there's wisdom for us in what could we learn from what your research has brought to help us navigate our own read on environments and our fear of emotions.
Well, you raise an interesting point, because you use the word regulation, and emotion regulation is a topic I do a lot of research on, and I know it well. There's many other excellent researchers out there who publish many other excellent works. And, one of the misnomers I think about the concept of regulation is that people, laypersons as well as researchers, conflate that term with suppression and downplaying of one's emotions. And the way I understand regulation is more like management, or like having your foot on the accelerator and brake of your car, because I think we regulate speed in the car. That means that sometimes it's functional to go fast, and it's also sometimes functional to slow down, and it's dysfunctional to go fast when you should be slowing down, as well as the other way around. But what I'm trying to say is that I think it works both ways. It's not just a suppression, calming down issue. I think in terms of a broad understanding of the concept of regulation, I think it works both ways. Now, I'm not a clinician, although my degree's in clinical psychology. That was a long time ago. And, I don't do any kind of clinical work, which is much tougher than doing research, I think. But, from a researcher standpoint, that's how I understand regulation. I don't know whether in the clinical setting, there are times when it may be good, beneficial for the client to then, step on the accelerator. I understand what you're saying, that sometimes we want people to put their foot on the brake. But I don't know. Is it? I would ask you. Is it?
I would say that
more
it's scary when I'm in a office suite and I'm seeing a couple, and the wife is learning, or the husband is learning, or whoever the partner is learning about information that the other partner doesn't want to hear, and you have an eruption and a door slams and there's yelling, and it's just like, please don't let my other suite mates and all the people in the office hear, right? So but at the same time, I agree with you that there's total benefit in seeing a snapshot of what somebody looks like in their raw, dysregulated form. But it's scary. It's scary to see the depths of certain emotions. It's scary to see anger to that level. It's also scary to see high levels of pain when you hear a story that's so painful. But I wonder, and it's interesting. I'm a only clinician only, and you're really a researcher only. I wonder, what would it be like for me to take a step back in an observational stance as I'm engaging? And what kind of cues could a clinician pick up that may be helpful to actually properly regulate and not suppress, but to see it coming?
Yeah, well, there are many. Probably in the nonverbal world, there are many. Starting from the way a person walks, from what they may be wearing that day, to many other kinds of behaviors that they may do. But the one that comes quick to mind are what's going to be in the face, because our emotions are expressed on our faces very well. And of course, most of the time, while we regulate our facial expressions all the time, because that's what it means to be a social animal, there are some contexts where it's more appropriate to express than others, but not everybody expresses the entire contents of their mind all the time, even when they're just talking freely. And I could imagine in situations like yours, where even when people are talking what they think is freely, they've got many other thoughts, some of which may be conflictual, some of which may be related to regulating what their feelings are, and those things will leak out. And I call them nonverbal leakage. Mm-hmm. And you will see leakage in the face as well as the rest of the body. But I think the face is the primary source of such leakage. And thus, one could be talking to you about how they feel about a certain thing. And then you may see some signs of emotional control, for example. Or you may see some other emotions that are commenting on the emotion that you're talking about. Because people have emotions about emotions, as you know. And so, once the perceiver, us, can see the entire package, the emotional meaning of the package, then we have a better idea or an information about how to navigate what is the best thing for this person to do. But my world is getting that information into your hands, right? What can you see better in terms of what's going on in that person's mind, even when they don't know it? Because most people don't know what their mind, all the parts of their mind, and what they're showing on their faces.
You kind of blew up a word I like to use a lot, which is try to be as authentic as you can. The word authentic. Yeah. And it's kind of interesting to hear you, even as I'm trying to be totally authentic, right? It may be, and I don't hear a judgment in it, right? I hear more of an evolutionary model, which is, even as I'm attempting to be authentic, right? Two-way street, meaning both myself towards patient, client, and client towards me. I'm attempting to be sincere and engaged. There may be leakage, right? That may come in regardless of my attempts to help and the client patient's attempt to convey what's going on.
Of course. Yes. And you mentioned, within evolutionary theory and mine and many other people's research, there's a lot of data that supports how the communication, what I call the communication package, looks like when it's more authentic. Excuse me. And the communication package, of course, includes the words and the content of the words, but also the manner in which those words are being delivered, in my facial expressions, my gestures, and my tone of voice, just as we are now exchanging in this video chat. And when we're in the moment having those communications, when the package is more consistent with each other, with the words, we gain more authenticity. And when the package is very large, when there's parts of the package that are contradictory to each other, when a person's tone of voice or their facial expressions are contradictory to their words, for example, then the authenticity goes down, and one starts to think what else may be going on, and that's the kind of leakage. And leakage occurs all the time. In reality, the issue then becomes, to what degree of leakage are we talking about, right? But when there's sufficient leakage, whatever that is, you'll see it, and we have a chance to know that, gee, there's something else going on in that person's mind. Wonder what that's about. And from my standpoint, when a person, one of the most effective ways to get people to then break down barriers to uncover what they've got in their head, not from a clinical standpoint, but from research and my understanding of basic human psychology, is when people perceive that someone else is interested in a non-judgmental manner, which is what you talked about, it's easier for them to then break down whatever psychological barriers they've got, to then discover or uncover and then talk about and explore and self-disclose about those issues.
So when you say, it's very interesting to me, this whole discussion of leakage and what is being communicated to me. The ultimate goal in our office is to have safety, a safe place, and we're both using the word. I can say things that I can say to people, like something like, "What on earth makes you comfortable with that?" And if it comes from the right place, it's going to land fine, right? It's not going to hit the person in a way which makes them defensive, because I know I'm coming from the right place, and I check myself a lot, and I wonder with this leakage, there's some of it is involuntary, meaning voluntary leakage would mean I was nervous about this call. I bet my face showed it, right? I'm not nervous anymore. Thank you. You're a great clinician. You settled me. I feel good already. But so that would show up, right? Like, oh, I'm speaking to Dr. David Motsumoto, right? He's published a lot of judo, all that stuff, right? So I got that, oh my God, and thing. So I'm sure it showed up in my face. And I didn't lead with telling you, like, I'm so nervous to speak to you, but it probably came, right? It probably, he's laughing for those who don't hear well, right? It probably came out, and I voluntarily suppressed it. I knew I was suppressing it, and my face may have shown otherwise. That's a voluntary leakage. And I think you're also talking about involuntary leakage, where I may not be aware of other things I'm expressing, right? So can you have both?
Oh, of course. And everything in between and beyond, right? I mean, all the ways that we psychologists, I think, kind of cut up the human psyche in our words, our theories, and all that stuff are just artificial ways to understand the mush in the mind, right? Mm-hmm. And from my standpoint, again, not a clinician, but the mind's a mush. Everything's all related to each other, and theories look good on paper, but as you know, once you close the door, there's a lot of gray area about all kinds of things.
So in your study of the mind and the sort of what its job is, right? What is the adaptive value of microexpression if it's not voluntary, right? I get it if I'm trying to hide from you that I'm nervous and my face is showing it. I can't help but express where I'm at in the moment. But what is the adaptive value of involuntary expression?
Well, for one thing, we'll go back to the word energy, right? And what I'm about to tell you is my understanding of how the mind works with regard to the microexpression leakage. But when a person's mind is operating and you've got a lot of cognitive and emotional load, which leads to all kinds of different conflictual thoughts and whatnot, you've got a lot of energy being generated in that mind, and it's got to dissipate somehow. I mean, emotion is energy, and I don't believe in cognitive load without emotional load. And so whenever you've got cognitive and emotional load, you've got energy being generated, and somehow it's got to dissipate. They're impulses in the brain that's going to tell the body to activate stuff. And those, when the mind is operating, one part says do this, the other part says do something else, the another part says do this other thing. Somewhere all that stuff is going to get assembled and going to be firing out, because those are all electrical impulses that have energy, essentially. And one of the functions of microexpressions, if we I can break it down to the neurology of this, but what happens when you have a microexpression is you have conflicting parts of the mind that lead to a tug of war in the brain over control of the facial nerve through the emotion centers of the brain. And because of that conflicting part of the mind, one part is going to win out in that tug of war. But just think of a tug of war when you got these groups, pulling at each other. Something's going to leak out, right? And that's what's going on.
So I look at it kind of like an oil change of the mind. The energy has to be addressed. You can't have lingering, stuck energy, right? It compounds. It's going to, the tensions, the conflict have to be expressed electrically.
I think you're right on the latter. I mean, I think I would agree with the latter part of that. The oil change by itself, the metaphor, generally is a good thing for the engine of the car, right? The fact that we have microexpressions may or may not be good or healthy. It's healthy in the sense that you dissipate the energy, no question. But there's a reason why the conflict is existing in the first place, in the mind. And I don't know whether having conflict like that in the mind for the long haul is a positive thing or not.
Kind of like carrying too much stress, too much of a burden?
Yes. Oh,
interesting. So that's very interesting. So you're not a purist of cognitive, like I just want to listen to your thoughts and your beliefs. It's the interplay of cognitions and emotions, right? And a whole whirlwind of them. And those varying thoughts in this mega machine, the brain, right, are causing oftentimes conflict and lack of insight and lack of understanding, right, inconclusiveness, uncertainty. And they're going to be expressed, whether I wanted to or not, they're going to be expressed in these micro expressions. And even though you study it, right, micro expressions from an adaptive evolutionary standpoint may not be the first class human, meaning it may be as we evolve. What do you think of the idea that micro expressions, do you think they'll stay?
Oh yeah, I think they'll stay. But I want to get to that. But let me just comment on what you just said earlier, because I think that for me that's some of the central point, because we psychologists talk about cognitions and emotions as if we can separate them, but the words themselves are just slices that we created so that we can talk about them and understand them. But I don't believe that in the mind that they're separable. And although some people may think I've got a cognitive theory or an approach about something, or other people may think I have an emotional, in reality, those are just gateways to the same mush. And in the end, they only work because they're just simple gateways to the same basic phenomenon, which is all intertwined together. Mm-hmm. And so that's how I understand that. I don't, in my mind, although I write, okay, here's cognition, here's emotion, because that's the way the field does it. In reality, I think there's no separation between that.
I kind of look at it like whatever portal I'm going to access, and my job is to reach people. It's part of what I do is how to reach them.
Yes.
So some people are more cerebral, and they really do well with the more cognitive sort of discussing ideas and core beliefs behind that. And then, like you're saying, the emotions surface that way. And some people need the bread and butter question, what are you feeling?
Yes.
Right.
And yes. And either way, even in the former way, my understanding of the efficacy of that is going to be because there's an emotional tie to the language. Because if there's no emotional change, then just having the discussion is just having a discussion without an emotional change, right?
Yes. Right. You have to access and have, and we talk about it in recovery, you can have a abstinence from your drugs and alcohol and have a plan of recovery. But one of my mentors talks about having an emotional experience with that as well. You can't just have a strictly cognitive experience with recovery.
Yeah. Now, and I'm sorry I went away from your question to me, but the question to me was about whether the microexpressions are going to be around, and I think so. I understand microexpressions to exist primarily because we're humans and we have that thing called the cortex. Because animals that don't have cortex or have less cortex are going to be basically impulsive. They have emotions or reactions, and they live according to the impulses of their reactions. However, since humans have this thing called cortex, then we're talking about regulation. Then we can talk about, hiding some things or controlling some other things and whatnot. And when we're in that world, then you have the leakage issue.
Right.
But if you only live by impulse, there's no leakage issue, right? Everything's leakage.
Everything is full on authentic. This is where I'm at the moment. I'm not having conflict. Shouldn't I isn't part of impulsivity.
Yes, that's right. Thus humans will always have the micro expressions, I think.
So this is very helpful. I would wonder, for me, what can I pin, like just a few pointers, because if I can read micro expressions, right? These messagings, the spatial messagings or gestures that you write about as well, how could it help me I may have a better window into the struggle or the tensions of my patients. Do you have any practical tools for clinicians, or is that something that you offer?
Well, yes, in our company, we have many different tools to do that. Let me just say, with regard to microexpressions, longstanding research has shown that most people don't see them. And those who do see them see something but don't know exactly how to interpret them. I do believe, however, that there are people whose professions are in the human face-to-face interaction, then they're more sensitive to them, even though they don't know they are.
Mm-hmm.
But that's the general lay of the land. Now, we've developed ways to train and improve everybody's skills to read microexpressions. And I don't want this to sound like a commercial, but there's ways to do it.
Okay.
And we train a lot, thousands of people in many different walks of life to do it. People will get better at seeing microexpressions. There's no question about it. Then the question becomes, what do you do with the information, right?
Mm-hmm.
And now you're in your realm, because as you can imagine, what you see at any one time is going to be it's what you do with that is so context dependent. And it's difficult for me to come up with here are these rules that you got to follow.
Right. I totally get that. So it's a very, very trained and informed a field of study that also has is as good as the information that it has in the field. Meaning, even if you're an expert, right? There's only so much. I wouldn't say it's at its infancy, but there's so much more that is going to be developed over time in how to read this information.
Yeah, no, I a little bit twist on that. I think that the ways to understand the phenomenon, we know pretty well what the phenomenon is, what microexpressions are, and when they generally occur. We have pretty good ways over the last 20 years of training people how to see them. Of course, as technology gets better, we'll get better in the future. But right now, there are very good ways. What the wild card in what you're saying, which I totally agree with, is what's the operator's standpoint? Because I see people who train to see other people's microexpressions and don't know what to do with them. Whereas there are others who get it immediately and understand how they can plug it into their life, whether they're a clinician or a law enforcement officer or a physician, or a lawyer. The application is so different.
Right. And for the audience, I did a little bit of background on, and I know that you've worked with law enforcement and the FBI. You have been called upon by many different facets within industry, all sorts of industry, helping professions as well as professions that need to really address deceit in interview. So there's wide application. I'm thinking of it for me. Somebody comes in with a very determined conviction about I can't believe this injustice. I can't believe you were so rude. And if I'm looking at the micro expression, I'm like, oh my God, this individual is saying all this, but they're showing me a vulnerability that they're conflicted even within their conviction of position.
Yeah, no, so that's a great example. Let's say that somebody's walking in and they have that great conviction. And of course, with conviction, there's an emotional basis why something's a conviction, right? And so they'll be expressing that emotional basis as they give the language. And maybe they're showing very determination, a little bit of anger while they're saying that, because it then becomes convincing. But then let's say that while they're doing that, there's a flash of fear. Or let's say when they're doing that, there's a little flash of sadness. Or let's say when they're doing that, there's a little flash of contempt or something else. It's the other stuff that's leaking that's going to give you, that's qualifying and speaking about that first emotion that now gives you, Adam, Dr. Adam, that additional data to then, okay, what was that about? How can I explore that? Is that meaningful? And now you're triaging, because you got to you're the operator at that point. You're triaging. Should I do something about that? When can I do that? And then you're figuring out how you're coming back to then help that person. But now you've got the additional data about something else that's going on in their mind.
Yeah, I so much so that I think you're right from my experience in terms of, or it resonated what you said earlier about, I don't know anything about the study of deceit or how to read it. I do know that in the settings I've been, right? Prison, maximum security prison, and drug and alcohol facilities, right? There's a lot of flagrant lying, flagrant, right, deception. And I often say the guy who walked in, I did not have the skill set. I wouldn't say I was a great reader of that information. And over time, there is a certain mastery that picks up on things that who knows what I'm picking up on. And I just want to touch on this for a little bit. I know that there's different expression levels in different cultural groups, right? That you'll have some cultures probably more just expressive in general, right? Like one of my mentors comes from southern Italy. Her grandparents do. And she, she said, people always accuse me of being like too much. And I went to southern Italy, to the town I was born, when I was 50 years old, she said. And she said, all of a sudden, everybody's like me. So everybody was, their hands were moving like me, and they were getting in each other's faces. And in America, I was told to tone it down. And there, it's like totally good. So I wonder if you could, if there's any wisdom for clinically in terms of understanding who we're in the room with.
Well, so you raise a really interesting point. Of course, there are large cultural differences in those kinds of expressions, but I call those macro expressions. Those are less filtered, less controlled, less regulated expressions that we just enact every day in our everyday lives. The world of micro expressions, however, in our face, the emotions that are portrayed in the face are universal to everybody, regardless of what culture they are. And when we're talking about the world of micro expressions, we're not talking about those large macro expressions that are culturally variable, very culturally variable. The micro expressions are much less. They're a product of the conflict in the mind. And deception or deceit are loaded words, but let's just call it leakage. I mean, I like the way we understand this, because they are signs that there's other things going on in a person's mind that we can pick up. Mm-hmm. And really, that's what it is. And
independent of culture.
Yes. And when they're in the face, they're independent of culture.
Yes. The micro. So for the record, right, this is interesting. And I saw your research on the Olympics and sighted versus the non-sighted. What you discovered is that there are innate facial expressions even in the blind, congenitally blind, and that those micro expressions are universal. And they represent, how do I deal with this terrible burden of equipment called the brain?
Yes.
Right. This is really stressful to have, especially if you're an overthinker, right? Even if you're an underthinker, I would imagine that you may be thinking on some level and conflict may come out, right? But that is really to hone in on what you do. It's detecting the expression of leakage. Right, I love it.
Yes,
detecting the expression of leakage, and I think that's how on earth does somebody become interested in that?
Well, I don't know how other people become interested in it. I landed in my I mean, this is a personal journey story, but I landed in my field totally by accident, and the fact that I just keep working on whatever I'm working on, and somehow I became the expert in this, the supposed expert in this area. But I didn't have the thought of becoming an expert in this field, to tell you the truth.
So you didn't wake up one day and say, you know what, micro expressions are so cool. This is so interesting. I'm dedicating my life to it.
No.
Now it sounds in listening to interviews with you, it sounds like judo, on the other hand, grabbed you in a way which you said, I'm doing it.
No. I hated judo. When I was a kid, I hated
really?
judo with a passion until I got semi good at it. And then judo's great when you get good, because then you're not suffering as much.
Because I was listening, I don't know your age. At the time, you were 59 years old, and you had been doing daily judo for 52 years.
Yes, and I'm 60 now, and that's so you can add another year to that.
Yes. So the theme of that question was the idea of showing up every day to something and having that structure was very, very helpful to you.
Yeah. Right.
This has been very, very helpful to me. I don't think that this is going to become a graduate school course in the next 10 years, right? I can't see like this as being a mandatory course that you must learn about microexpression to get to know your patients better. But I do see wisdom in just taking a step back and taking in what you're hearing. Do you have any, I know you're not in the same seat as me, you're in the seat of academics. Do you have any parting words of wisdom for people like me? And I love what you said. You can get the information, then I have to deal with it. And it's true. Do you have any parting words? But sometimes it would be helpful for me if I can get the information sooner, right?
Oh, yeah. Well, sure. I'm all about people in the helping professions to get as much what I call data superiority. It's information about the people that they're helping. I want people in your profession to get that kind of information because you're helping others be more effective and functional in their life. And learning to read micro expressions, understanding nonverbal behavior and nonverbal communication in general are great ways to get that little extra information about the people whose lives you're touching. And here's another little comment, just on our last exchange. We were calling it leakage, and we went through deception a little bit. Not all leakage is negative, right? A lot of some leakage is very positive. Also, we're just seeing whatever else is going on in that person's mind. And in people in your situations, I think that would be a good thing to get that additional information. But of course, it then comes down to what would you do with it? But most people have a good. I think I have a good heart and a good mind to do something positive for the people they're working for, and that's why you do that.
Data superiority, right? Getting as much information as I can, and having to be present with not just the words and the meaning of the words, but the whole experience, including.
Right.
We didn't even talk about the nature of gestures, and which you study as well, and these universal micro expressions that occur. If somebody was interested in learning about what you do, is there a particular, especially the discussion we had, is there a book or where would you recommend a beginning point of a student of Dr. David Motsumoto to start?
Well, sure. So you can access my academic work as well as our practical work by coming to my company's website, which is humantel.com. There's contact info there. If you need some resources, you want some pagers, it'll link also to my academic side, and you will see papers if you're interested in that kind of stuff. If people who are interested in learning about how to improve their skills and stuff, there's stuff there. Just reach out. We'll always take care of all the inquiries there.
Well, I what a rewarding conversation during quarantine here, or at least whatever phase we're at. And I thank you so much for helping me get less nervous. And as we progressed, I think I came into my own. I said you're very easy to talk to, even though you saw my face. And I don't know I only saw good vibes in your face, but I'm no expert.
It is what it is.
Yeah. All right. Good to meet you. Nice to speak with you.
Same here. You take care.
You take care. Bye-bye.
This podcast is for general information and entertainment purposes only. This should not be considered treatment advice, nor is it a substitute for an individual treatment plan. If you have questions or concerns about your individual situation, it is strongly recommended you consult a licensed professional to talk about things that are specific to you. If there's an emergency, it is strongly recommended you seek treatment at your nearest emergency room.